Get started then. Hi, everyone. My name is Molly Hogensack, and I'm a PhD candidate at Columbia University School of Nursing. And prior to that, I worked as a bedside nurse. And today we'll just be talking about, in this breakout session, how we as learners can engage and explore AI in health professional education. And I think that we all just come in with such a unique and rich experience as students. So I'd love to just dive into exploring how we can advocate for competencies and experiences that we think have either enriched our learning experience or could in the future. So I'd also like to introduce two of my planning committee members who are here with me as well, or ask them to. Dr. James, would you like to introduce yourself, please?
Sure. Thank you, Molly. Good morning, everyone. I'm Cornelius James, and my clinical practice is internal medicine and pediatrics in a primary care setting. And I'm at the University of Michigan in Ann Arbor. And my research interests include actually implementing artificial intelligence and machine learning into education or curricula, and also implementing digital tools into clinical practice. So nice to meet everyone, and I look forward to our conversation.
Thank you. And Dr. Shapiros, would you like to go next?
I'm Carl Shapiros, and I'm a member of the forum in the planning committee, and I am at Texas A&M University, San Antonio, and my primary area of practice is in clinical mental health. And I do a lot of work in the AI space and the integration of mental health, and lead a research team around the integration of AI into mental health practice, and do a lot of work around the social determinants. Nice to meet everybody.
Okay. I think Molly may be having some technical difficulties. So, we'll keep the ball rolling. What I was going to do is just ask everyone to just kind of go around and just kind of say who you are, where you're from, and then just maybe provide a little bit of info about your experiences with artificial intelligence, machine learning, or, if you don't have any at this point, totally fine. But I suspect that many of you do have a little bit. So we'd appreciate that. And I'm going to just start with, I believe that's Dallas. I see your name tag there, but on Zoom it says your name is in-person speakers and attendees. I doubt that that's your name. So go ahead, Dallas.
Yes. Hi, everyone. My name is Dallas Peoples. I am a PhD candidate, and I don't really know where the camera is, so sorry if I'm looking everywhere. But I am a PhD candidate at Texas Woman's University in Denton, Texas. I do not have a specific background in AI. So my major is sociology with a concentration in health and illness, but my interest is specifically in the use of clinicians, using AI tools and the social implications of AI and how this impacts patients' healthcare experiences.
Thanks, Dallas. And then Nolana, would you like to go next?
Yeah, my name is Luana. I have an undergraduate degree in biomedical engineering from the University of Arkansas, and I'm currently in my first year in the MA and MS program at OU for nutritional sciences. I have a little bit of a background in AI, as I did some undergraduate research on a machine learning tool to identify hip implants in X-ray images and stuff. And so that's kind of my background in that.
Thanks. And Judy?
My name is Judy. I'm also on the planning committee, and I'm a professor at Emory University. My clinical work is an interventional radiologist, and I also do informatics, and increasingly our research is around artificial intelligence, building diverse data sets for bias and fairness evaluation, studying how AI works in the real world setting and fails, and also training the next generation of data scientists and AI experts. I ran a machine learning elective at Emory. We're in our third year now. And also train high school students. We have an ongoing program in Rhode Island and Indiana.
Thank you. And then Winston?
Yeah, hi. I'm Winston. I am from Rochester, Minnesota by the Mayo Clinic, but I'm a MD student here at Cornell now. So I guess my exposures are mostly like theoretical through research. I've done some stuff with NLP. I used to do some stuff with kind of image recognition and radiology. I'm just trying to explore, what I could do in the kind of programming side of that. But yeah, still trying to learn more about kind of computational approaches, health informatics, and how AI kind of influences also kind of the background of the EHR.
Thanks. Alonzo?
Good morning, everyone. Hope you all are doing well. My name is Alonzo B. Turner. I'm originally from Raleigh, North Carolina. I am a doctoral student at Syracuse University. I am not an AI expert by any means, but my most recent experiences that I've had in terms of gauging interest with utilizing AI in the counseling field as I'm pursuing a PhD in counseling and counselor education has been course development. So being able to bridge the gap between non-traditional learning settings, as recent as this school year, being able to develop a course and transitioning it from in classroom to online, and being able to use different AI tools to say, okay, how are we measuring these learning experiences? How are we making them accessible for students who may not have ability privilege? And also recently, I've started taking on some coursework in order to pursue another certification. So in the counseling profession, we have different certifications, and this course is dealing with being a board certified telemental health therapist. So that way, again, being able to bridge the gap between the counselor, the classroom, and the community.
Thanks. And then Erican?
Morning, everyone. My name is Erican. I'm a MD PhD student at the University of Michigan. My background prior to coming to Michigan was I did my undergraduate and master's training in engineering. Then I worked for an electronic medical record vendor for a couple of years. And I got sort of interested in the fact that we have all this data, but we weren't really putting it to great use. So that sort of led me down the path to the MD PhD here at Michigan. I recently defended my dissertation, which was in essentially machine learning model development and implementation. So built several models, deployed them here in our health system, and they're running, and we're sort of monitoring them. So all the interesting problems that occur when you take an idea about machine learning or artificial intelligence and then try to push it into the clinical space. And so very interested in seeing how we can go from maybe pushing ideas into actually developing ideas in a collaborative way where physicians, engineers, nurses, everyone else in the healthcare team is sort of driving the development of these as opposed to sort of a technology-driven approach. So that's me.
Thanks. Did I miss anyone? Okay, great. So I think we kind of touched on this, but I wanted to provide space if anybody had any further comments. When you hear the word AI, what comes to mind? Are you excited about it? Are you nervous? What are your thoughts?
All of the above.
Thanks. Any other thoughts?
I think I agree. Oh, sorry. I was going to say, I think I agree. I would say that it's very exciting because there's so much you can use AI for, and but that's also part of the fear and like scariness of it is that there is so much that can be done with it, and it's always changing and it'll always be improving. But that also is the fear of like trying to catch up and trying to learn everything there is, and trying to all of the not knowing what really it involves.
Yeah, thanks. And just to highlight what Cornelia said, if you feel more comfortable putting your ideas in the chat, feel free to put them in there too. And then, do you think that you and have your peers, are they
I think Molly's still having technical difficulties, but that's okay. I wanted to go back to thank you for that comment, Nolana. Erican, you mentioned all of the above. Can you tell me a little bit more about that, all of the above?
Yeah, so that, it was a little bit facetious, but not 100%, right? So I think like a lot of technologies, artificial intelligence, depending on your definition of it, it could be very broad. But like a lot of technologies, it has the opportunity to be used in ways that greatly improve our work, right? Make things more efficient, help us discover things, help us live longer, right? Like all these things you could potentially say, I'm going to make an artificial intelligence model and it's going to be able to help us, detect something in the hospital that maybe when we're taking care of patients as, physicians or nurses, we're just sort of overloaded and we're not able to look at that. So I think there's all this upside that's always been sort of, it's been part of the hype, right? And I think it's a very real upside. I believe in it. I've seen it. I don't necessarily know that it's a guaranteed, we're going to get it type of thing, just by making the tool that will actually get the purported upside. I think there's a good amount of risk associated with these tools. And this is not my area of expertise at all, but a lot of people have been working very diligently on uncovering the bias and various other problems with just making these models and sort of not thinking them through very carefully, from where does the data come from to how do we connect the model to the workflow, and then even systems issues, right? The system that creates the data, if there's bias in that, and you're trying to recreate something that is occurring in the system, then you might be perpetuating bias. And so those things, we potentially have the ability to scale harm, just like we have the ability to scale a improvement. And I think we have to be very careful in our sort of movement forward. And so I think that risk is very big. And oftentimes, I think we've been talking about it a lot more recently, but I think it's been undercounted. And so I think we really need to have people that know the clinical space, the learners that are in the clinical space, be able to identify deficiencies and be able to push to say, we need these tools to work in a certain way. And actually, if it does this, that's not a good thing. And here's the reasons why. And be able to work with technical partners to be able to uncover those things. So I think that the benefits are real. The risks are big. And so in that sort of trade-off, I think basically because I think the benefits are so good, we need to work very carefully to avoid the risks as much as possible. Is sort of my long-winded answer to a facetious short answer.
No, that's okay. Thank you for that, Erican. Would anyone like to comment on anything that Erican just stated or just mentioned? Sounds like we're saying the benefits appear to be there. Some of them we are realizing now. Others, they are potentially coming further down the line, but there's also significant risk associated with these technologies. And we need to kind of find those trade-offs, or figure out what those trade-offs will be. How comfortable are we with the risk versus benefit? But then also to realize those benefits and identify those risks, it sounds like we're going to, as stakeholders, as healthcare professionals, whether it be as nutritionists or physicians or counselors, et cetera, we're going to have to be a part of that. How does that make you feel, knowing that you are a stakeholder and that you will need to become comfortable, get comfortable with being a part of that conversation? How does that make you feel? What do you think about that?
Yeah, as I will say, how's your last name pronounced?
It's dealer's choice, so however you'd like to say, but I like to go by Oatless.
Oatless? Oh, so I'll say Dr. Oatless. Congratulations.
They have not conferred me the degree, so and even so, that Erican is great.
Okay. But as Erican was speaking about the risk reward, something that was coming to my mind again was, as you mentioned, Cornelius, was like the trade-off, right? Where we talk about nothing in life being perfect. And even in the session that was before this, there were concerns that were raised or reviewed about ethics and morality, and saying even with humans, while there can be ethics and competencies and moralities like that are literally written in legislation, they may not always be carried out the way they're supposed to. And so as Erkin was talking about risk and reward, it made me think about just how important it is for us to become more knowledgeable. As you're asking that question, like, how does it feel to know that we're going to be on some level conduits or catalysts for this shift? For me, like being able to be as knowledgeable as possible, so that way we are able to explain to not only our peers in our respective disciplines, but also to the students or the clients or whomever we will be serving, by giving that transparent information to their level of understanding. By being transparent, there will be an increase of trustworthiness, being able to reduce the likelihood that, or some of the distrust, if you will, that people have in technologies. It kind of makes me, as we talk about AI, even opening that question that Molly asked, like, the opening question is, what comes to your mind? And people tend to think about movies. They tend to think about films. They tend to have this robot type of thing, where most people are more like Detective Spooner, like, nope, you mentioned a robot, you mentioned artificial intelligence, AI, nope, out of it. But the twist or paradox is, like, people are using it on a regular basis, albeit for other things, whether it's Alexa, whether it's Siri, whether it's their apps. And so again, just looking at our respective disciplines and professions, especially as we're operating in potential integrated healthcare models, being able to have that information so that we can, again, build trustworthiness by being transparent to the communities that we'll serve.
Wow. There's Alonzo, a lot there, a lot of great comments. I really appreciate that. The first question that I wanted to ask you about, though, in relation to what you just said, and anyone feel free to answer this. You mentioned the word being conduits. And I kind of look at that as kind of being you said conduits to this change or for this change. And I'm just curious about the kind of going back, kind of similar to my question related to being a stakeholder in this space. Any thoughts about that? How do we get there so that we are effective conduits, be it the next generation of health profession students that are coming, or to our patients that we need to help to establish that trust? And I say that a bit cautiously, because in some respects, patients will have more trust in AI tools than we do initially, because there's direct to consumer advertising. So I say that a bit cautiously. But how do we feel about being that conduit? And then the second part of that is how do we get there? Any thoughts about that?
I think one thing that has been brought up a lot today was like being that why of, I think it was mentioned earlier, of why. Patients are always going to ask, why are you diagnosing me this? Why is this happening? Why am I doing this medication? Why? And I think and that's the same thing with AI, is why. And as it was mentioned earlier, is that why cannot be offered through AI. So one of the things is being that conduit is going to incorporate being the interpreter. And I think I don't think AI is ever going to take the place of people, because especially in healthcare, because we are interpreters of what the patient is saying, what we're trying to explain to them, what medications, how to explain. And so part of being that conduit is going to just be a really good interpreter, and even incorporating that into other fields and even teaching the next generations coming up is going to be how to interpret what that that data scientist is saying, and interpret what like the medical experts are saying, and trying to find that common ground to where you can be a bridge between those two fields.
Excellent.
I do have a question actually. Or,
yeah, go ahead, Judy.
Yeah, so yesterday we had a grand round here. And the speaker came here, which, 7 a.m., we're usually trying to run our list to get started. And when it took a lot, this speaker is fantastic, has changed the world of interventional radiology. She does make this documentary called Without a Scalpel. And I think it's just so interesting. It's available on Prime. I have no rights, but I think it's interesting. You're looking for something to watch. And what I realized was if we had not mobilized the IR team and changed a lot of things to come to the grand round, people, I think we are underestimating the post-COVID changes to the workforce and the workflow. Now, medicine, you do have to run, but I wondered where the trainees were because, and it hit me that one of the big changes that our department made, and it has over close to 150 radiologists, that everyone has a homework station. Actually, the station next to me is a homework station. And so now you think, how do you staff the trainees, right? So you're staffing them through teams. And I think we may also be lagging behind understanding how training is changing, and especially from medical students. I know that at some point you could live in Kenya and be a medical student in the US because everything is online. And so I really just liked the last comment that we have to either come up with a theme that's not too technology focused, or really meet where our learners are, but they have completely changed. And I'm old, but I'm not that far removed from training. And I feel that I also don't even understand the current trainees. 3 days ago, my fellows, we were in a big argument because we use a robot for doing our IR procedures to use for guidance. And they said, we hate the robot. We want to remove it. It's not going to be in our place where we go to work. And it was just this really spirited discussion. But when I was training just 4 years ago, we never used to do biopsies in my fellowship program, but here I do them. And so this adaptability, is so important, but the learners are like, no, it's March. I'm leaving in 3 months. I can't do a lung biopsy on my own. And I need, I don't want the robot, to be used for any case. And so it's these tensions that we have to, I'm curious to the learners, what's really changed and what's the reality? Because I think we're Zooming or teaming and we're out of where things are.
So I wanted to bring up, there's a couple of questions from the online audience. And the first one was from Beth, who said, as students, this webinar is focused on clinical use of AI, but I wonder if you all as students are concerned about peers using AI for cheating. And I think that goes along with some of the discussion that's been happening so far about where do we see this fit into our role and what our overall perspectives are of AI. So Beth said that is certainly a concern of faculty members, which has been part of a lot of discussion in different forums across throughout the world recently. So just your perspectives on AI as cheating.
I would say for my program, there is no resources for AI. And we actually got a new professor and he is very heavily promoting AI. And so he allows us to start to incorporate and get students knowledge and expanding their choices. Our professor lets us use any sort of AI source that is available to answer questions. So it is in a way cheating because you're not answering your own questions, but it's also, I think, beneficial because you are starting to incorporate AI into education that wasn't there previously. And it's getting students thinking of what can AI do and what can I do? What can I be a part of it? Is this adequate information? And then goes back to that same interpretation of taking what it gave you as an answer and then reading it, seeing what is true, what is not, and then using that to answer.
I think one thing that comes to my mind is I'll be interested to see how the syllabuses and the policies shift. I mean, I think what we see Turnitin is very common nowadays in academia, and that's a way to flag plagiarism. And I wonder if there will be a new mechanism, whether that be AI or not, to identify when ChatGPT has been used. And I think it'll just be important that educational leaders be really clear about what is allowed and what is not allowed, because I think as a learner, one of the most frustrating things is to have that shift within the time you're completing a coursework or your coursework. So just really being, I think, clear about what the expectations are as a educator and also as a learner, I think will go a long way in hopefully facilitating mutual understanding. And just as we see this, I think ChatGPT and other AI technology be even more increased in the educational setting.
Yeah, great points. And I'm hearing things like words being used like adaptability and inflexibility. And I know Eric put something in the chat there and he has his hands up. I don't know if you were going to comment on anything related to that.
I was going to comment on the ChatGPT question, and then maybe I'll find a way to connect it to Dr. Gichoya's excellent point earlier, but I'm not entirely sure how I'll do it. So we'll see if I can come up with it extemporaneously. So the ChatGPT question is, it's interesting, but I don't actually I almost want to ask a question back, and this is sort of a philosophical question. What is the point of writing an essay, or what is the point of doing some work as a learner, right? Oftentimes it's to develop a skill, right? And so if I'm asked to write an essay, that's probably, and it's usually for me, I wasn't an English major. I was, writing essays for an engineering course, to explain a project, right? Or to convince someone that a certain design was better than a different design, or someone should follow my methods in the future, right? And so oftentimes it's more of a persuasive argument type document, right? You're trying to construct a story and you're trying to get readers to buy what you're sort of laying out. And so if I can use ChatGPT to effectively communicate my argument without introducing errors, without undercutting my own argument, and if it generated some of the sentences, maybe that's a good thing, because maybe it took me less time to write that document. Maybe it's a better document because of it, potentially, or maybe I can use it as the substrate from which I started, and then maybe I got over my writer's block. So I think we want to think very very clearly about what the intentionality is of an assignment, and use that to define sort of the relationship between the student and the AI tools that are available. And then also our teachers are probably going to use AI tools as well, right? So there's this very interesting relationship that's going to arise, and it's going to be between student AI tools, teacher AI tools, other assessors, right, and AI tools. So it's sort of what is the intention of this thing, and how do all these pieces fit together, I think is sort of probably the more nuanced way to think about it, as opposed to should we allow it or not? And I think that's where we're going. And I think I'm going to stop it there. I'm not going to connect it to the other point, because I see Winston's hand is up.
Great point. So I think what I'm hearing, Erican, is kind of thinking about big picture, ultimately the goal is to try to, and with the example that you gave related to writing an essay, the goal is to say, this is a great essay that articulates a point that I'm trying to articulate, and whether there are sentences in there that are completely and directly from me versus from an AI, ultimately the goal is to write a persuasive essay, and ultimately it's going to be up to the student to determine whether or not it does that and then submit it, right? So great point. Winston, you had your hand up.
Yeah, sorry, Eric, I didn't mean to derail your point, kind of connecting. But no, I really agree with what you've said about kind of, especially with ChatGPT writing essays. Like right now I'm in the ethics section of my courses, and it kind of would be a good way to kind of at least, serve as a substrate, kind of begin to kind of at least present in a linear way just the possible arguments that are out there, like for and against, and then to kind of like train that, or not train that, but kind of put it up against my current understanding and then see where I do or don't agree. And then I can formulate an argument and then maybe write a better paper because of it. It doesn't have to like write all of my sentences, and, hopefully it doesn't. And I think I also agree with your other point that you wrote in the chat, which is that sometimes the medical training, the way it's built, it kind of incentivizes us against, kind of fast change, like kind of overly embracing technology. And another use of ChatGPT that my classmates kind of use, half seriously, half playfully, is kind of like looking at, like basically using it as Google. And sometimes it can actually provide, one of the caveats on the tool itself says that sometimes it will generate wrong information. So that is well known, but then it can be used kind of as a quick kind of tool to survey kind of maybe a new field of information, because we are students, we're very early, like I'm only in my third year. And it can also maybe suggest some kind of mechanisms between, connecting this and that fact, which is also a good way to, help build an understanding and scaffolding in your head. And then kind of along the lines of cheating, that, the concern where AI tools will make students kind of skip out on some of that building of like the foundational like clinical reasoning that we need as doctors. The way it's built, especially with like exams, like step 2 are very kind of formulaic in the way that they have students kind of recognize clinical scenarios with the combination of lab clinical features and all these things. So despite the use of kind of tools to kind of learn however they may do during their first few years, students are still forced to grapple with that reasoning in the end. And then in the clinical spaces as well, they can't kind of, at least as far as I know, students aren't kind of just like using AI tools to kind of expedite their clinical reasoning. It's more just kind of amassing clinical knowledge through like established sources, like up to date, kind of as they go and when they go home.
Great points, Winston. And I will also say that, as many of us know, up to date is not always up to date, right? Meaning it does not always have accurate information. So, I mean, if we wanted to make that comparison, knowing that the potential consequences, given the how broadly these technologies may be implemented, the consequences could be significant. But we know we're all going to have to get better at information appraisal, right? Determining whether the source of information is acceptable and the actual information that they're presenting is acceptable as well. And I see your hand up there, Nolana, but I wanted to ask a quick question kind of related to some of the things that Eric and I'm going to definitely get to you. But I wanted to ask your thoughts, the group's thoughts about this. These terms are de-skilling, reskilling, or potentially teaching new skills. How does that make you feel as students? What do you think about that? And I'm thinking about that in terms of artificial intelligence and machine learning. Do you see a need to kind of rethink or reconsider what's currently being done in health professions education, or in your currently education, specifically in relation to AI? Any thoughts about that?
While they're thinking about that, I think that also goes to some of the questions that are online in terms of de-skilling and reskilling around faculty members in the education process and what it looks like. So as you're considering your responses, think about that too, in terms of de-skilling and reskilling.
Milana, go ahead.
So I think one of the interesting things about computer science AI is that you don't need to have a degree in it. You don't need to take classes in it. You can teach yourself. There's so many resources, so many programs, so many methods to learn about this on your own. So I think one of the major things I can see, kind of playing devil's advocate here, of like professors or that higher level than us as students is going to be that there's potentially students that are coming in that might have way more information and knowledge of AI and computer science and what it has to offer than what the faculty might have. And so I do think that I like competencies. And so there's going to be like how to incorporate those and what that looks like. There's going to have to be some sort of educational methods or tools to educate those faculty, because they're not going to be able to educate the learners or the people coming up if they aren't even educated. So there's going to have to be some reskilling and types of things like that, because it hasn't been used in the past and it wasn't incorporated into training of that generation that is now teaching these younger ones that might have more information.
Thank you very much. I noticed that I was not muted. I was writing, and you may have heard my pencil hitting the paper because I was trying to get down all those wonderful comments, Milana. Go ahead, Erican.
This is a very interesting question to me, because I'm actually like thinking about, there's a museum just down the road between Ann Arbor and Detroit, and it's like the Henry Ford Museum of American Innovation, and it's basically like. Henry Ford is a potentially problematic human being, but he created this museum where he just took all the things that he was interested in from various American innovations and technology and put them all in sort of one area. And so he has like a tinsmith workshop, and there's like a steam house with old steam engines and all this like old technology, right? So technology that has ostensibly been eclipsed by one of the things that he worked on, right? The automobile. And so they sort of like, it's a working museum. They sort of demonstrate some of these things, and they show how, you would make a sock, or you would, make a lantern with like tinsmithing or whatever. And we don't actively, like, those are not active technologies that are used anymore, right? So those are essentially like, we have as a society chosen that it's not worthwhile to maintain those skills. And so there's a natural, when technology evolves, there's a natural like reskilling and deskilling and upskilling that occurs. Medicine, I don't think has really done that much in the past. I'm speaking very much from like a medical student trainee perspective, looking at, from the 1950s till now, there's been a lot of technology that we've adopted, but maybe some of the cognitive processes that we use, we haven't really changed it. A lot of, the way we'll order labs, and then we interpret the labs, right? It'll be individual labs. It's not labs for a specific question. Usually, like you won't say like, I need to answer like AKI specifically, and like send like to AKI labs, although there's like a specific, like you might think of that. There's like oftentimes though you're asked to like figure out what things you want to do, what's your differential, what are your testing plan, then how are you going to interpret it, and how are you going to do therapeutics based on that. And so one could think about like, well, is this the best way to think about pathology? Is it the best way to think about diagnosis? Is it the best way to think about therapeutics? And I think it's pretty good, right? So I'm not saying like, let's upset the cart here, but I think we have an opportunity to think about the way that we have data, and not just data on individual patients, but data at scale to help us with our decision making. And I think that presents an opportunity, and this is very limited to the physician perspective, but I think everyone in the health professions probably has similar things where they can think about, well, what's another way that we could approach our cognitive processes? And one thing that I really want to like underscore is AI shouldn't be used as like a gold standard, right? So if there are gold standard techniques that underlie things, gold standard assessments, we need to work very carefully to make sure that we do not lose skill in that, right? So I think Beth had a point about like, well, we don't want to lose the ability to actually be able to like write prose. Like if need be, a student should be able to write prose, right? So I think, you know, depending on where you're in your training, maybe there is a time that you're told, like, I want you to just like write something without any assistance, just so that you have the ability to do it, right? And so we're going to need to work very carefully, just like redesigning the way that we do work, the way that we train, so that we have these skills that are core and we will always have them, or we develop them so that we have, you know, new tools or whatever. But we have to be very careful that we don't offload something that actually like should never have been offloaded, because like AI could only do a proxy of the gold standard, which was a human assessment or whatever.
Excellent point, and kind of consistent with one of the points that was brought up yesterday. When the pilot's flying the airplane, lots of AI is happening there, right? But if the AI for some reason is not functioning the way that we'd like it to function, we want that human to be able to come in and take over and have the skills necessary to land that plane if necessary. Alonzo, did you have something?
Yeah, Dr. James, you brought up a really great question, and Erkin really covered a lot of what I'll say. So I'll just, again, be very brief, because as Erkin was sharing, like the word that came to my mind was the effectiveness. And again, just the foundational skills that you would have. I think about the counseling profession in general, especially over the past 2 or 3 years with COVID, where master's level counseling students, they were having a different experience in terms of gaining those counseling skills and doing it in settings where they may have not been able to have the most personable experiences with their clients. So a lot of them were thrusted into teletherapy experiences. Even we think about school counselors and what that looked like for school counselors who were not able to go and walk the halls of the school. They were literally thrusted into, oh, I have to do school counseling differently, or this is not what I initially thought my practicum or internship experience would be like. And so as Erkin was talking about just the adaptability, we definitely have adapted in our respective disciplines, from punching paper timesheets to people now being able to, if they still do timesheets digitally, they do that. But like, I think about counseling in general, where you keep the foundation of your theories, you keep the foundation of your professional orientation skills, and being able to hold space while also understanding that if you have to write a case plan, not relying on a chat GPT or an AI to have to write a safety plan or a case plan. It's good to be able to enhance that and to be able to formulate what am I potentially missing, but also being able to say, well, when I'm sitting with this client or when I'm sitting with this student, what's happening in that moment? And how am I utilizing the AI tools to enhance those basic helping professional skills?
Great point. Thank you, Alonzo. And it's interesting, you know, I heard you say kind of keeping those like foundational or core components of who we are and what we do, right, as healthcare professionals and providers, and then kind of figuring out what role AI plays in allowing us or helping us to accomplish or be who we are or do the things or carry out the roles that we want to carry out. Excellent point. Nolana, you have been so patient. I wanted to come back around and see if you still had that thought in your mind when you had your hand up about 5 minutes ago or so. Did you have anything you wanted to say there?
Yeah, it was kind of back to like the cheating chat GPT. So one of the things that had been mentioned very heavily was that, and from like the professor's aspect or the faculty's aspect, or when they design courses, it's based off of credentials you have to meet for licensure. It's based off of competencies. And so it was mentioned briefly of like, if you use ChatGPT for homework or essays, then it's going to kind of bite you in the end when you take your exams, because then you're not going to know. But from my perspective is that as a nutrition student, there's a lot of courses that don't have those exams. It's a lot of just projects or papers, assessing research, assessing data, and like trying to figure out. So using that ChatGPT in that sense, my question would be like, are you losing your tool or that goal that was like that paper was used for, or are you, so like in the future, are you going to be lacking by using AI?
Excellent point. Any thoughts related to that? I was going to also note that there are some high impact journals that are allowing individuals to use ChatGPT with an acknowledgement of use of ChatGPT. So some of you may also be aware of that. So one of the things that I notice as I look around my screen is that we have a diverse group of individuals on a number of different levels, but I'm thinking specifically when it comes to our health professions or our professions. How do we as a team work together to, or what do interprofessional teams look like as we look to make this happen, as we look to ensure that we're seeing more benefits when it comes to use of AI in health professions versus the risks? Does the team look different? Is there another stakeholder, another student that you would like to see involved in this conversation? How do you see that looking or moving forward?
I think in healthcare, there's been a huge push in the past couple of years for interprofessionalism. I think that that's one of my areas that I am very passionate about, is just like interprofessional education and communication. And I have noticed that there's a huge push of like incorporating doctors with nutritionists, with social work. But one of the things that I think is lacking is that computer scientist or that programmer or the data scientist or informatics person in that healthcare team, especially if you're using AI to help, like we've mentioned before, of like, they have their expertise in that field, and they won't understand anything healthcare related or very minimally. And for us in healthcare, we might have that large, like knowledge in healthcare, but we don't have that knowledge in that computer aspect, AI. And so there needs to be some way to facilitate, to get that why that we're searching for through AI, that machine learning or that AI or ChatGPT can't provide you. And so I think having somebody in that field and into the healthcare team would be very beneficial.
Excellent. Thanks for that point, Nolana. Any other thoughts about that question?
I have a sort of brief thought. I think I think we need to have more interprofessional efforts in this area specifically, because reflecting on my own work, like it's really been not very interprofessional. In fact, we've had one of the projects that we tried to implement ran into some issues because of it just didn't have the right people at the table during some of the development portions. And so when it came to implementation, those people were affected and then there were problems. So having that interprofessional relationship, even from the outset, even if you know these people, then you're a lot more comfortable with being able to reach out to your nutritionist friend or your PT, OT friend and say, hey, we're working on this thing. What are your thoughts on it? And even if it's not, even if you didn't think it was directly related to maybe their workflows, maybe it actually, like they might have a great idea, or they might say, oh yeah, when I see these types of patients, I see X or Y. And you're like, oh, like we should use that information. Like that's not information that I normally look at as a physician, but like, yes, you're so right. Like let's figure out a way to get it into the AI model. So even having that foundation will be helpful. I think one of the barriers to that is that we often approach these like AI tools or models from like a specific task perspective. So we're like, oh, this is for sepsis. So then you're like, the sepsis model is going to be used by doctors. Maybe it'll also be used by nurses. So we'll talk to them, as opposed to thinking about like a patient focused, right? Like, so if we say like, oh, like, let's think about like improving the patient experience with sepsis. Like, what are AI tools that could be used, and how might that not just be for early detection of sepsis? Maybe they'll be used for other parts. And that's actually potentially a richer and better way to use these things than just sort of approaching everything as if it's a nail for your hammer.
Thanks for that, Erica, and appreciate it. And you also brought up patients, and perhaps not in the professional realm, but certainly someone that we need to be considering in our learning, right? So how are our patients interacting with and/or engaging with these tools? Can you see simulations and/or clinical skills courses where patients are coming in with knowledge and/or questions related to AI, perhaps in the future? Molly?
Thanks. And I just wanted to hit on some points that I think Erica made beautifully. And I think the first is like, if we don't include users early on, then they're not going to be implemented. And I see this as a very, very big gap. I mean, I think that we see this like really great development of these AI tools, and sometimes clinicians are involved in creating them, sometimes they're not. But when it goes to rollout, if these users weren't involved, then they're going to think about it as in, oh, this is just another thing for me to have to do. And I think that clinicians are heavily burdened right now by all the tasks we're asking them to do. So really helping to establish that buy-in earlier on by including nurses, doctors, whatever you want to fill the blank in with, and patients to say like, oh, I can also see how this will help me, or this is how I would also modify this application to make it more focused on my clinical background. I think will create the strongest tools.
Excellent. Thanks for that, Molly. And kind of piggybacking on that point, I recently met with someone from the Gordon and Betty Moore Foundation, and they were explaining, so we're talking about a particular problem, but at times, or a particular task the AI may be carrying out, but at times, developers are not asking the right questions. So they're coming up with brilliant ideas about a particular issue, but sometimes it's not the right issue, or it's not an issue that is not, in some cases, worth addressing, or to be quite honest with you, sometimes no one really cares about, right? So you can potentially appreciate the benefits of having individuals like yourselves who are kind of coming together and saying, these are the questions that we need answered. These are the things that we'd like to address, and/or these are the questions that our patients would like answered. And these are the things that they would like addressed. Okay, I have another question for you. Let's say you've got like pie in the sky, right? And everything is just in an ideal world. What would you like to see right now, like implemented into your particular educational program or your curriculum? Knowing that things will not or cannot be perfect, but if we could make a change tomorrow in relation to AI, ML, these technologies in your particular curriculum, what would you like to see implemented tomorrow? It's a big, hard question, but give it a little bit of thought. If you have something, totally let us know.
I think this is a very interesting question. So with nutrition, there is a lot of bias because food is the basis of like everything. And one of the major proponents in nutrition research is going to be like marketing and like Pepsi and Coca-Cola, like funding all of these different research. And so I think there's a lot of fear with AI, and especially in the field of nutrition, and how since it is kind of basic of like, oh, you can create a meal plan, but like that's the bare minimum that people think about with incorporating AI. So I think for me, I would see that trying to use it in a more intricate level and more as a tool and as an education tool, because if you're using it as just like it can create a meal plan for you, then that's not really the extent of what you are trained to do as a nutrition, because in this field, there's so many competencies of patient-centered care. And even though this is what the textbook says, their wounds aren't healing. You're going to need a higher protein count than what the textbook might say. And so if you're incorporating AI into that, the AI might tell you what the textbook says, not what you should be doing based off of your patient that's sitting in front of you. So if having some sort of educational method to assess or incorporate more of like that medical healthcare professional into that development of AI, so it's not so black and white.
Thank you for that, Nolana. And any other thoughts? If you were to implement something into your curriculum tomorrow related to AI, what would be priority number one at this point? And I think, sure, Carl, did you have something before we?
Yeah, just to add to a response to that from some folks that are online, talking about the rapid development of regulatory compliance and how that is often reactive rather than proactive. And so we end up being behind the times in terms of the educational component. But what several folks have commented on is that the idea of interprofessional education, implementing that in conjunction with AI, and then thinking about the workflow process and how that evolves as AI as a part of the treatment team.
So one of my wishes, I guess, if I could just have a wish in terms of how we could restructure at least physician education is, I'm sort of staring down the barrel of residency, and I'm excited for it. But one of the things that I know is that there's a lot of time that you need to spend becoming clinically adept, right? But there's not a lot of additional time to think of, like, to take some time and think about, like, oh, how could we actually, use machine learning? How could we use artificial intelligence in this process, right? How could I like experiment with these tools and build that into my practice, so to speak? And so if I could just have, like, if I could wave my magic wand and say, like, maybe we make residency 10% longer, but that meant that every other week I had like a half day where I got to, experiment with AI. If I had the ability to like plug AI tools into my workflows to be able to adjust my clinical informatics setup, right? Like those would all be things that I think would take me a long way towards a better future state, right? I think I would even, like, that would be a nice place in which I have a sandbox to play with. I have time. I have tools. I can mess around a little bit, maybe with the electronic medical record, right? Like things like that, I think would be phenomenal for me personally. And then thinking about like, well, structured didactics would be excellent, potentially allowing learners to be able to have a foundation and then choose if they want to develop mastery at various steps. Like that would be great. And then echoing all the sort of the importance of the interprofessional piece, I think having interprofessional educational opportunities with my health professions colleagues and then also my engineering colleagues and informatics colleagues as well would be I think phenomenal.
Excellent. I'm going to go ahead and give Molly the last comment. Go ahead.
Thank you. Yeah, I think I would just say, I know it's very simple, but I would just like to know what are the questions I need to be asking before I use a certain tool. And then my hope would be one day there'll be a database where I can just search like sepsis, CDS, and it tells me exactly like, what is this? Why is this important clinically? What do I need to know to use this? And like whatever other details, but I'm hoping that's the future. But I think that for that database to be useful, we need to know like what are these high level questions I need to know as a clinician to use this tool and to feel confident in using it. Thanks.
Excellent. Wow. You all, I've probably got like 6 or 7 pages of notes here with all of the wonderful comments that you all have made. So really appreciate that. Really appreciate the participation of our audience. Any final or parting comments? Carl, anything on your end?
No, we've covered the questions, I think, across the board. So thank you.
Excellent. All right. Well, great job, everyone. It looks like we are about to enter back into the main session, and we will see you there. Thank you.